Okay, so in this video I'm going to talk about gynecomastia. And gynecomastia actually is the presence of, as clear here, abnormal amount of breast tissue in males. Okay, so this is male breast tissue and it's abnormal as obvious. Usually we find that amount of breast tissue in females, okay? But if we find it in males, then we call this gynecomastia. Actually, usually the gynecomastia is caused by increase the amount of estrogen to androgen ratio. Okay, it's not about the estrogen alone or the androgen alone. It's about the ratio between them. If we have an increased amount of estrogen, okay, the ratio will increase and we will have gynecomastia. If we have a decreased amount of androgens, then also the ratio will increase and the gynecomastia will be the result. So when we move out to the causes of gynecomastia, we will find out that anything that can increase the amount of estrogen or decrease the amount of androgen will be an important factor or an important cause for gynecomastia. Okay, so let's start with the causes of the gynecomastia. Actually, the first thing that you have to know that the gynecomastia sometimes is a normal or physiological finding, okay? And this is in puberty, okay? It's normal to find gynecomastia in puberty. But after which if you have a persistent gynecomastia, you have to think more about it. Okay, now let's think logically about the causes of gynecomastia rather than the physiological cause. Okay, we said that anything that decreases the androgen or increase the estrogen may cause gynecomastia. Let's start with the things that may decrease the androgen. Like what? Like some syndromes that may cause androgen deficiency, like Kallmann syndrome. Okay, and the other syndrome is the Klinefelter. So always remember the syndromes that start with the K, the Kallmann and the Klinefelter syndrome, both can cause gynecomastia by decreasing the androgen. What also can decrease the androgen? Androgen, a good part of it is made in, or androgens in a good part of it are made in the testicles. So the things that may cause testicular failure may cause gynecomastia. Okay, so testicular failure, like what? Like the mumps infection. The mumps infection may cause testicular failure, and that will decrease the androgen and increase the estrogen androgen ratio, and that will lead eventually to gynecomastia. Testicular cancers like seminoma, for example. Okay, cancers like seminoma may cause testicular failure and gynecomastia. Okay, now let's move to the causes of increased estrogen. Okay, that may lead to gynecomastia. The first thing you may think about is, for example, ectopic tumor secretion of estrogen. Okay, tumor secretes estrogen, that will lead to gynecomastia. Or some people that take estrogen, okay, externally, that this may lead to gynecomastia. Okay, liver failure actually may cause also gynecomastia. Why? I guess because liver makes some estrogen binding globulins. Okay, estrogen binding globulins. If we have liver failure, this estrogen binding globulin will not be made anymore, and the estrogen will be more free in the circulation. Okay, and that will lead to increase the percentages of estrogen in circulation, and this may lead to the gynecomastia. Hypothyroidism is also a cause of gynecomastia. So again, the things that decrease the androgen or things that increase the estrogen. Testicular failure due to mumps infection or cancer, okay, like seminoma. The syndromes that decrease the androgen, like Kallmann or Klinefelter syndrome. The things that increase the estrogens, like the liver failure, the ectopic estrogen production, or taking from outsource. Okay, so now let's move to another important entity of causes of gynecomastia, which is the drugs that may cause gynecomastia. And actually it's an important thing to learn, because a lot of exams questions will ask you about some drugs that may cause gynecomastia. Actually, there is a good mnemonic for drugs that cause gynecomastia, which is the disco. Okay, the disco. What the D goes for? Yes, I'm impressed. Yeah, it is digitalis. Okay, I won't just write it all, just digitalis. Okay, the I. The isoniazide. Yes, isoniazide. Now the most important one, the S. Spironolactone. Yeah, and actually it's the most common drug that can cause the gynecomastia. So digitalis, isoniazide, spironolactone. The C. Yes, you're right. Cimetidine. Yeah. And the O. The O is for estrogen. Yes, of course, estrogen. Drugs will cause gynecomastia, as I said. That's good, buddy. Okay, the D for the digitalis, the I for the isoniazide, the S for the most important one, which is the spironolactone. Okay, and the C is for cimetidine. The O is for estrogen. Actually, if you take estrogen, you will definitely have a gynecomastia as a male. Another good mnemonic for gynecomastia is metoclopramide. Sorry for that. Okay, each one of these letters goes for something that may cause gynecomastia. Let's start with the M. What does it mean? Yes, metoclopramide itself can cause gynecomastia. The E. Yes, you are smart. Ectopic estrogen. Metoclopramide, ectopic estrogen. And the T for trauma for skull, a tumor for breast or testis. Trauma for the skull, tumor for the breast. Okay, and some problem in the testis. Okay, so good for now. Metoclopramide, ectopic estrogen, trauma for the skull, tumor for the breast or the testis. The O. Oh, do you remember that some infections of the testis will cause gynecomastia due to androgen decrease? Yeah, the orchitis. Metoclopramide, ectopic estrogen, tumors with trauma, and the orchitis. The C for the cimetidine, the drug that we talked about. Okay, and the L for liver cirrhosis. Do you remember the estrogen binding globulin? Okay, the O, obesity will increase the estrogen, and estrogen will cause gynecomastia. The P for paraplegia. The R for rheumatoid arthritis. The A for acromegaly. The M for methyl dopa. The I, what drug? Disco. Oh, disco. D, disco. Digitalis. I, isoniazide. D, digitalis. I, isoniazide. D again, digoxin. Okay, and E is ethinomide. Okay, so these are two mnemonic for the gynecomastia. The first one is the disco. Okay, digitalis, isoniazide, spironolactone, cimetidine, and estrogen. And the other one is metoclopramide. Just please remember the metoclopramide itself, ectopic estrogen, and the trauma, orchitis, cimetidine, Cushing syndrome, liver cirrhosis, obesity, paraplegia. Okay, rheumatoid arthritis, acromegaly, methyl dopa, and the isoniazide digoxin, and ethimidine. Actually, there are some other rare drugs that can cause gynecomastia, like tricyclic antidepressants, the calcium channel blockers also can cause the gynecomastia, methyl dopa, as I said, okay, and other things. Now let's move to the treatment options of the gynecomastia. First thing you have to do is to identify and manage any overt underlying cause. Okay, so the cause, whether it is drug or something that increase the estrogen or something that decrease the androgen, we have to manage the underlying cause, and then, or meanwhile, we can do what we call the liposuction. Okay, the liposuction, the suction of the lipids or the gynecomastia, will give you the best cosmetic outcome. Okay, so this is a brief talk about the gynecomastia. Thank you very much for watching this. See you in another video.